This is COVID-19 with Dr. Richard Brown.
Hello, everyone, and welcome back to Dr. Richard Brown COVID-19 update for today. So it is September 14, 2022. It has been approximately 2 years, going on 3 years, since we first became aware that there was this invisible virus that was in danger of killing us, the COVID-19 pandemic. And here we are now going into almost nearly 3 years. And so now you know a lot about this disease. You know that it is deadly. You know that now there are vaccines that have been prepared to help prevent you from getting sick. You also know that they are safe, they are effective. You know that we have vaccine now for children. We know also that those who are most vulnerable are those who may not have the best health, those who have underlying conditions, those who are overweight, the seniors, elderly is very vulnerable to this disease. We also know that wearing a mask helps to protect you from acquiring the disease. We also know that the way that people are infected is through droplets that come from your nose, your mouth, and it floats in the air, and then you insert it into your nose or mouth, and that's how it gets into humans. It's a human-to-human infection path that creates the environment for this COVID-19. So there's a lot that we need to talk about further, even though we know all that information. So I'm going to provide some updates on where we are at this point. So we know that hospitalizations are down, and we know that deaths are down. We know that more people have been vaccinated than was vaccinated 2 years ago. And we also know that people are still becoming infected with this disease. Those who have been vaccinated, as well as those who have not been vaccinated. But I would venture to say that the risk at this point is with those who have been not vaccinated. I continue to talk with people and hear from people that say, oh, so-and-so has now caught COVID. First question I ask after that, were they vaccinated? Majority of the time, I'm told that they were not vaccinated. So we know that if you are vaccinated, then your chances of becoming infected are less than if you are not vaccinated. So all these things we know, and hopefully many of the myths have been dispelled about this disease. We know that it's not an experimental thing that's going on with human beings in the United States and across the world, that these are scientifically proven vaccines that have been developed over years and years of experience and research. And so we know that there's no metal chips placed into the vaccine that does anything to us that people don't want to have done to them. It's not a tracking device. So, based on the CDC latest updates, I want to talk about a few things that you need to know. So, COVID-19 infection levels are different in different communities. And so it is important for you to decide and or find out what the communication or infection level is in your particular community. And at each level, it means different actions and precautions may need to be taken. There's a high, medium, and then a low level of that have been identified with this disease as CDC has described. So using the data that you gather based upon your individual community helps you to decide on how you should protect yourself. And this is looking at data like the infection rate, looking at the hospitalization rate, looking at the number of cases. And using this data, it's important to pay attention to it like you pay attention to a whole lot of other things that in some cases are very meaningless, like some of the social media stuff that you pay attention to. But this is life-saving information that you should pay attention to. So your local health department, state health department, physicians and other healthcare professionals and clinics usually stay up to date on what the levels are and on what the latest information is on COVID-19. We're continuously learning about this disease. And so as new information comes about, then it is shared with the public. So many people in the United States have some protection or immunity against COVID-19 due to the vaccinations and or previous infections. So this immunity, combined with the availability of tests and treatments, have greatly reduced the risk of severe illness, hospitalization, and deaths from COVID-19 for many people. We had no treatment 2 years ago. Now we at least have treatment that we're still tracking and testing to ensure that it does what it says it's going to do, and to track and make sure that we capture what it is doing and what it's not. But at the same time, some people, such as those who are older or immunocompromised, they have certain disabilities or have certain underlying conditions, they continue to be at higher risk for serious illness. So you should learn all that you can about those factors that put you into a higher risk group if you fall into those categories. And I talked about on the last podcast, many of the categories and illnesses that people have that increase their risk for becoming very sick from COVID-19. So know your community level and take action to protect yourself and your family based upon whatever those community levels are, whether it's high, medium, or low. So based on the level, there's things that you should do. One is you must stay up to date, as I mentioned, on the vaccination and where to get those vaccinations and what the vaccination rates are, as well as becoming familiar with the boosters and the dosages. And I'll just say that if you've been vaccinated once, then depending on the type of vaccination you got, you need to have a second shot. And there is a booster that you now need. And not only the first booster, but there are second boosters that you may need. So you just have to stay up on top of what the latest data is from your local communities. And as we speak, CDC is developing an additional vaccine to boost against the variants that have taken place. We've had the Delta variants, and then the Omicron variants, and then the BA.5 variants. Those variances are a result of the virus continuing to mutate and doing what it can to stay alive and insert itself into additional hosts so they can do what they do. Now, we as humans, we need to do what we do, which is to fight against it by getting vaccinated and boosted. We should follow all the recommendations for what to do if you're exposed to COVID-19. Some people have different ideas about what they should do. I just heard of one case in which a person has been exposed, they've been diagnosed with having COVID, but they didn't have very many symptoms. So within 5 days, they went back to work, and they work in a public arena where they're subject to not only spread the virus to others, but get reinfected. So if you're high risk of becoming infected, you should definitely talk to your healthcare provider. And if you get exposed, do everything that you should do to protect yourself and others. And you should definitely stay in and be isolated at least 5 days after the onset of the disease. And you can quarantine longer than that if you have an opportunity to do so. the thing to do is to make sure that you take the medication that's available and that you get the rest that you need and that you isolate yourself from others. So one of the frequently asked questions lately, since we've learned a lot about this disease, is, do I need a COVID vaccination booster? I've already mentioned, yes, you need a booster. Recent data suggests that COVID-19 vaccine effectiveness at preventing infection or severe illness, it sort of wanes over time, especially for certain groups of people, such as people who are 65 and older, and those who are immunocompromised. The emergence of COVID-19 variants further emphasizes the importance of vaccination, boosters, and prevention efforts needed to protect against COVID-19. Data show that the mRNA booster increases the immune response, which improves protection against getting a serious COVID-19 infection. CDC recommends COVID-19 vaccine for everyone ages 6 months and older, and boosters for everyone 5 years and older if eligible. So, do the boosters work? Yes, they work. COVID-19 vaccines are working well. They work well to prevent severe illness, hospitalization, and death. However, public experts are seeing reduced protection over time. It isn't protecting people as long as they thought it should. There's mild and moderate disease, especially among certain populations, that causes the protection not to last as long. So are there risks associated with taking booster shots? Well, with adults and both children, there are some side effects from a COVID-19 vaccine. So includes side effects like some pain, some redness, or swelling at the injection site. You might become a little tired, you might get a headache, you might get muscle pain, you might even get some chills and some fever and some nausea. But the very serious side effects are very rare, and but they may occur, but they are not as bad as the alternative, which is hospitalization and death. So how long does the protection from COVID-19 vaccine last? Scientists are continuing to monitor the long effects of the vaccine protection. We know that it protects you from going into the hospital. We know it protects you from death. However, health experts are seeing decreases in the protection over time, especially for certain people. As I mentioned earlier, the elderly and those who have comorbidities and who are immunodeficient. Now, lots of conversation and questions about the menstrual cycle that women have, the period. Results from recent studies show that people who menstruate may observe small, temporary changes in menstruation after COVID-19 vaccination. And these may include longer duration of menstrual periods, shorter intervals between periods, heavier bleeding than usual. But despite these temporary changes in menstruation, there's no evidence that COVID-19 vaccines cause fertility problems, which has been a question on the minds of a lot of people. Now, if I'm pregnant or plan to become pregnant, can I take the vaccine? The answer is yes. And we know that folks don't always plan to become pregnant. However, if you do, then you have your answer already. It is recommended for people who are pregnant, who are breastfeeding or trying to get pregnant, as well as those who might become pregnant in the future. this weekend, next week, next month. So people with COVID-19 during pregnancy are more likely to deliver a preterm, which is earlier than 37 weeks, or a stillborn infant, and may also be more likely to have other pregnancy complications. So those are the reasons why it is good to take the vaccine. You know that there's something out there that's dangerous to your health and can be dangerous to your child's health. But there's a vaccine that can protect both you and your child. And so you should take it to minimize the opportunity for this virus to interfere with your life or your child's life. So the answer to the question of if I become pregnant, can I take the vaccine? Yes, you can. Another question is, why should my children or my teens get vaccinated against COVID-19? Well, COVID-19 can make children and teens very sick and sometimes require treatment in the hospital. Now, they're resilient, they're young, many of them are healthy, most of them are healthy. They're getting plenty of exercise. But some children get very, very sick and have to be hospitalized. So that's a good reason to make sure that they get vaccinated. So getting eligible children and teens vaccinated against COVID-19 can keep them from getting really, really sick, and there's short-term complications associated with even having to go to the hospital that you don't want to do. You want to stay out of hospital if you possibly can. They do a great job for those things that you need to be hospitalized for. But if you're in there for something minor or for something that isn't as serious as surgery, there's things that can happen. There's a couple of 100,000 per year incidents of malpractice and erroneously treating or making mistakes with patients just because they happen to be hospitalized. That's just the nature of the industry, and it's a great quality system for certain. But those are the data, not an opinion, those are facts. About 200,000 people a year die in hospitals due to an error being committed by one of the hospital employees. So the benefits of COVID-19 vaccination outweigh the known and potential risk. CDC recommends vaccination for everyone ages 6 months and older, and a booster for everyone 5 years and older, if eligible. So another question is, why should I get vaccinated if I might get COVID-19 anyway? I've heard people say that. Well, let's say everybody's eventually going to get it. And so I may not and probably won't die because I'm young and healthy. So why should I get it if I'm going to get it anyway? Why should I take a vaccine? Well, COVID-19 vaccination significantly lowers your risk of severe illness, hospitalization, and death. Compared to people who are up to date with their COVID-19 vaccinations, unvaccinated people are more likely to get COVID-19, much more likely to be hospitalized, and much more likely to die from COVID-19. Now, you'll hear that from me over and over each time I talk to people, because those are the facts. Those are not opinions. The death rate amongst people who have COVID-19 is what it is, and it occurs. I'll share some numbers with you a little later. So like all vaccines, COVID-19 are not 100% effective against preventing the infection. Some people who are up to date with their COVID-19 vaccinations will get COVID, and there's something called breakthrough infections. However, staying up to date with your COVID-19 vaccinations means that you're less likely to have a breakthrough infection. And if you do get sick, you're less likely to get severely ill or die. Staying up to date also means you're less likely to spread the disease to others. And that increases your protection against the new variants, as I talked about earlier, the mutations that the virus undergoes. So we've talked a lot about some of the emerging questions and some that are still around. And so I encourage you to make sure that you stay focused and pay attention to what you hear when they're talking about COVID. Some people have just tuned out any discussion about COVID-19. They don't want to hear it on the news. They don't want to hear it from their peers and from other organizations. And they're going out and participating in activities in groups that are very, very large, and they are continuing to spread the disease. There's only about 72, 73% of the US population that has been immunized, which is a lot. That's great. But we have not achieved herd immunity yet. Herd immunity won't occur until we get above 85% of people in the United States being immunized. And what that means is that the herd, the majority of the population is immunized. And so there's a small percentage of the population where the virus can jump to and infect other people. And as long as that percentage is very low, then the virus has less places to go and less opportunity to make people sick and ill. Our lifestyle has changed dramatically over the past couple of years. Dramatically. And we're eager to get back out into the public and do the things we used to do. And many, many people are doing that. We're back to having concerts and indoor restaurant eating and going back to church and singing and dancing in the clubs and doing all those things that put you in an environment in which particles of respiratory particles can go from your mouth and your nose into the mouth and nose of other people. And if that virus is still there, and we know it's still out there, then we could continue to keep this lifestyle less than what we want it to be, because the virus is still there, lurking in the dark to infect more and more people. So, as of today, September 14th, 2022, COVID-19 is on the decline in the US. However, it went up a bit once we started school a few weeks ago, but it's coming back down, and that's good. But that doesn't mean it won't go back up if we don't continue our safety practices. So we still have about 300 deaths a day due to COVID-19 in the United States, which is down from a few weeks ago at 400 a day. But one death, if it's your mother, father, sister, brother, grandmother, uncle, aunt, is too many just because of COVID-19. Now, it's not said per se that the Queen died of COVID-19, but we know that she contracted the virus, and she's 95 years old. And so the conditions and factors that make infection more severe and deadly were all there for her. And so one person to die is too many people to die from COVID-19. So we still have about 70,000 cases, new cases a day in the United States. New cases, still about 70,000. And Dr. Fauci says that anytime we have more than 10,000 cases a day, then we're still vulnerable, and that's unacceptable. So I hope that this update provides you with some food for thought, provided you with some action to take. And also, I hope it helped you to think about listening when people are talking about it again, so that you can correct them if they're saying something that's erroneous, and so that you can learn whatever it is there might be that's new that you can benefit from, because we are learning every day. And as new knowledge is obtained and learned, the Center for Disease Control does give it to the public and to the healthcare organizations throughout the nation. Because of my circumstance and involvement with healthcare and communicable disease, I get an update every single day from the Center for Disease Control and Health and Human Services about not only COVID-19, but other healthcare issues and healthcare concerns, like the value of physical activity and chronic diseases and nutrition and all things prevention. So for today, that's all I have, and I will be back again to talk to you about additional updates. So this is Dr. Brown, and I'll see you around.
This has been COVID-19 with Dr. Richard Brown. If you'd like to leave suggestions, email us at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.